Welcome to Donate to Save Life, a YouTube channel. Ladies and gentlemen, today we are extremely pleased and honored to host our guest, Dr. Amudha Hari. She is one of the leading gynecologists and expert in infertility services in South India. Today, she is going to talk to us about how to maintain menstruational health and hygiene. Let's listen to the video.
Good evening, everyone. I am Dr. Amudha Hari. I am a consultant gynecologist and a laparoscopic surgeon with my very special focus on infertility therapies. I've been practicing in Chennai for the last 25 years, and I've had an occasion to design and implement a lot of community programs for women and children. These exposures have taught me to understand that the women are the most precious, at the same time the most strained population. Now, what is a very important event in a woman's life is menarche, which is the beginning of the menstruation. The beginning of the menstruation is a time when a child becomes a woman, literally. So this is a time when she has to understand, a child has to be taught, a girl child had to be taught how she as a child has to transform herself to a woman when she has a menstruation. Now, because once you have a proper understanding of any situation, it is always very easy to handle it. So when a girl child has to manage menstruation, first she has to understand what is menstruation and what are the things that are normal during a menstruation. Now, first to understand that what happens, menstruation starts first as telarche. What you call before the menstruation, there is a development of breast, there is a pubic hair that develops, there is an axillary hair that develops. The child, which was looking like any child, starts to look like a girl child. You have the hip growing, you have your hips getting shaped up, and your body fat is being repositioned. Now, this is when is the first stage of the menarche. Then telarche, the breast develops. Then third is your menarche, where you are able to see the menstrual flow that starts with the child. Now, what are the normal myths and misconceptions regarding menstruation? Everyone says, is it normal or is it mandatory for every girl child to have a menstruation regularly during a month? That is every 28 days, like a clockwork. Because you see a lot of mothers becoming very worried and bringing their child for a checkup because that particular child is not having menstruation for 2 months. Okay, what is normal? Is it mandatory to have menstrual cycle happening every month? The answer to that is every body is unique and every body can have a rhythm of its own. So it is usually possible, about 60 to 70% of the girls, to have monthly cycles. But it is also normal for certain girls to have cycle every once in 2 months or once in 2.5 months. All this is normal. So you ask me when it is mandatory for a girl child to go and check whether it is normal or not. Let us say a girl is been having regular menstruation and suddenly there are 2 to 3 months of no menstruation happening. That is amenorrhea. If that is the situation, then it is mandatory for the girl to have a gynecological examination. Now, that is for something about your cycle. So you can have irregularly regular. That is every 2 months once is something what you call as irregularly regular cycles. That is unique to that particular girl. So it is not mandatory for every girl to have 28-day clockwork cycle. Now, what is a normal flow that can happen during a cycle? And before we go any further, it is also sometimes okay to have a little bit of irregular cycles if it is your first year of menarche. Because this is a time your hormone sets, your body sets, and you start going to have a normal menstrual cycle. So let us say you have just started menstruating and within the next 6 months you have a little bit of irregular cycles. It is okay. It is okay to have a little bit of irregular cycles when you're on the first 6 months to 1 year of your menstruation. Okay, now you have started menstruating, you're on a normal pattern, whatever be your pattern, you're on a normal pattern, and suddenly there is a break in the pattern. You have not had periods. You used to have periods every 30 days once. Now it is last 2 months you have not had your periods. It is also then mandatory for the girl to have a gynecological examination, because it could be anywhere between a very simple issue to a very complicated issue. It could be simple anemia, a hormonal imbalance, or just anemia that is causing the irregularity, or it could be a complex ovarian problem that is causing an irregularity. So whenever there is a deviation in the pattern, there is a deviation in the regularity of the cycle, a girl must have a medical examination. Now, what is the second understanding you must have is, what is a normal flow during a menstruation? They say anywhere between 50 ml to 60 ml is a normal flow during a menstrual cycle. Now, what do you consider as abnormally heavy bleeding? Let us say the girl has very soaked every 2 to 3 hours with lot of clots. Then, and if it is exceeds any of these amount, then it is to know she has a abnormal heavy menstrual periods. Now, abnormal heavy menstrual periods could be because of, usually without any reason, I mean, you are not able to see any obvious reason, which you call as dysfunctional uterine bleeding, or with any obvious reason like a polyp or a fibroid or any other things. That is the reason for her heavy bleeding. So whenever there is a heavy bleeding, you think the period cycle is extremely heavy, you have to consult a doctor to understand what is the reason for her predicament. Now, third important thing in a cycle is, there is always some pain, some discomfort attached to the menstrual cycle. You can categorize it into mild, moderate, and severe. Between mild and moderate girls, I don't think there is a requirement for them to take any medication for this pain and severe discomfort. But let us say there is a girl who has severe discomfort, a physical problem that is ranging to vomiting, a severe pain, she's cramping and she's not able to carry on with her regular work. It is okay to take some antispasmodics under a doctor's supervision when during her periods, because there is a myth in so many countries, including India, saying that whenever there is a medication that is taken by a girl during for her menstrual discomfort can cause problems during her marriage and childbirth, which is not true. It's a myth. So you can, if you are a girl who has a severe dysmenorrhea, you have a severe discomfort that is not letting you do the regular work during your menstruation, it is okay to have an antispasmodics under medical supervision. Now, the fourth important thing is there is a white discharge that is normal in a girl? Yes, white discharge is not all the time abnormal. During periods, mid-cycle, and just before your periods, you can definitely have an increased white discharge, which is normal. Now, when are you saying that these are abnormal and they need medical intervention is when you have a lower abdominal pain, when the discharge is not in white in color. It could be yellowish, greenish, curdy. Then if you have itching, then you have irritation. All these are symptoms to understand there is an infection or there is definitely any pathology which need to be looked into. So, white discharge per se is not a medical problem, but when it's extremely intense or it is accompanied by itching irritation, please have a medical intervention. Now, what are the things that is very, very important to avoid a urinary infection? One is your menstrual hygiene. Very, very important for a young girl to have a proper menstrual hygiene, like trimming of hair, to keep the genital area clean and neat, and to, let us say, definitely switch pads, that is, change pads at least, if not in 2 hours, at least in 4 to 4 hours, so that there will be a complete menstrual hygiene that is maintained, because they can cause, if it is not, if you don't, your genital area is not hygienically maintained, you can pick up infections, urinary tract infection, general infections that can become a problem later, because right from the genital area it can go into the cervical canal, into the uterus, into your lower abdomen through your tubes and cause pelvic inflammatory disease. So it is mandatory for young girls whenever they have an infection to understand what it is, to get a treatment as soon as possible and to work on it. So with these basic factors, you have to understand menstrual hygiene, awareness about what is normal during your periods, and understanding of when and where you need a doctor's intervention during menstruation is very, very important in your being a girl.
Thank you for watching this video. We are sure that you find this video useful. Please watch our upcoming videos and do not forget to subscribe. Thank you very much.